Welcome to your Barbados Today Evening News Update, today Tuesday, April 14. A 52-year-old man today became the fifth person to die from COVID-19 in Barbados. Health officials report that the patient passed away this morning. Since April 4 men and one woman have succumbed to the viral illness. The country also recorded one new case today, bringing the number of infections to 73. The latest patient is a 48-year-old man who came into contact with a known case. Meanwhile, 2 more patients have left isolation, bringing the number of recoveries to 15. 53 people remain in isolation. A warning to countries to exercise extreme caution when transitioning to more flexible social distancing measures. It came today from the director of the Pan American Health Organization, Dr. Carissa Etienne, who noted that social distancing measures are enabling countries to better respond to the COVID-19 pandemic.
This remains our best bet to reduce transmission and slow the spread of the virus in our communities. It prevents hospitals from being overwhelmed by too many sick people at the same time, and it also keeps doctors and nurses from having to make a terrible choice about which patients receive care and which patients do not. It is also a way to buy time for new treatments, medicines, and vaccines that will allow us to fight COVID-19 and recover from it. In short, physical distancing measures give our societies a chance to respond to the pandemic. Following these measures is not easy, and it will be tough on our economy and our way of life. But the pandemic has taught us that these measures work.
In another forum, COVID-19 was a talking point today as the International Monetary Fund released its World Economic Outlook. IMF chief economist Jita Gopinath warned it's a crisis unlike any other, as she reported that global growth will drop.
Under the assumption that the pandemic and required containment peaks in the second quarter in most countries in the world and then recedes in the second half of this year, we are projecting global growth in 2020 to fall to minus 3%. Now, this is a downgrade of 6.3 percentage points from January 2020, a major revision over a very short period of time. This makes the Great Lockdown the worst recession since the Great Depression and far worse than the global financial crisis. Assuming the pandemic fades in the second half of 2020 and that policy actions taken around the world are effective in preventing widespread firm bankruptcies, extended job losses, and system-wide financial strains, we project global growth in 2021 to rebound to 5.8%.
The IMF economist said debt levels are expected to rise significantly over the next 12 months, and she urged multilateral organizations to provide greater support to developing countries.
Now, moratoria on debt payments and debt restructuring may need to be continued during the recovery phase. Now, multilateral cooperation is vital to the health of the global recovery. To support needed spending in developing countries, bilateral creditors and international financial institutions should provide concessional financing, grants, and debt relief. Collaborative effort is needed to ensure that the world does not deglobalize, so that the recovery is not damaged by further losses to productivity. At the International Monetary Fund, we are doing our part. We are actively deploying our $1 trillion lending capacity to support vulnerable countries.
CARICOM Chairman Prime Minister Mia Mottley will tomorrow lead another emergency meeting of regional leaders to discuss the COVID-19 pandemic and its impact on the region. The meeting, which will be held via video conference, will examine the economic fallout, ways to increase cooperation in public health, and how to maximize opportunities under the CARICOM single market and economy to ensure countries can withstand the impact of the pandemic.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news now, in Jamaica, several groups are stepping up to the plate to join the national fight against the coronavirus. More in this report from Television Jamaica.
We learnt of the Monotech engineers repairing faulty ventilators. Other engineers have approached the government offering help. Recently, the health minister met with a group working on two vital pieces of equipment.
And they have actually created a shield, which we have inspected and deemed to be useful to be used by our doctors in the system. So they are now manufacturing those shields. They also are working on a model to create a ventilator. I have not yet seen the prototype. I've seen some pictures of it. They think they are onto something, and I'm interested to hear because they are talented.
Church leaders in the meantime say they are willing to help.
I know of persons who have spoken that they're willing to offer facilities, and that now is out of my cap as the leader of the church. At the Costas person have approached me, which I've indicated the Ministry of Health, that they're willing to offer their property for such.
Churches have always been willing for their spaces to be used in times of crises and outside of crises. With respect to those that hold properties that can do and offer this kind of service, I am sure that if requested, they would comply and support the government.
For the health minister, the response from the society so far is good.
On the international scene, U.S. President Donald Trump has instructed his administration to halt funding to the World Health Organization. He said the WHO has failed in its basic duty to respond to the coronavirus outbreak. He accused the UN body of mismanaging and covering up the spread of the virus after it emerged in China.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.